Okay, with that, let me welcome you to today's webinar, the next in the Bay Area Impact series on COVID-19. I'm Jim Wunderman. I'm President and CEO of the Bay Area Council. It's a great pleasure for me to welcome today a really good friend and a tremendous leader, UC President Janet Napolitano. I know she's very well known to all of you. She has served as the president of the UC system since 2013. Before that, she was a very, very successful elected official serving the state of Arizona as governor for 2 terms. She also, following that, served as President Obama's head of Homeland Security, which she did in I think, a very, very successful way. And in fact, oversaw the response to the H1N1 virus back in 2009 to kind of bring things home and current and relevant. And she's been noted twice on the Forbes list of the world's most powerful leaders. So very versatile person, I think very successful person. And if you look back at Janet Napolitano's record over these 7 years as the head of the UC system, you know, whether it's translating innovation into new products and inventions, to human rights, to improve social consequence, global leadership, research, you name it. She's been a terrific leader for the institution, and we've been very, very pleased to have her work with us in partnership. So it's just been tremendous, and we kind of hate to see you go. But on the other hand, I think it's fair to say that you served well. So maybe at the end, I'll ask you what you plan to do. But before I do that, let me open it up and welcome you, Janet, and have you maybe say some opening comments about you know, where you think stand for the UC system.
Well, thanks, Jim. It's good to see you. I think we're both dialing in from home. I'm at my dining room table where I have been since the middle of March. I live in Oakland, so I will be here at least through the end of May, and spend my day on conference calls and video Zooms, and really trying to lead the University of California system through this pandemic, which is a huge challenge for all of us. So just briefly, the UC system is 10 campuses. It's 5 academic medical centers. Those are the big teaching hospitals. It's 3 of the national laboratories. It's a statewide agriculture and natural resources division. We have about 230,000 employees. And we have about 270,000 students. So it's a big, diffuse organization. Annual budget close to $40 billion. And so what are we doing? What have we done? Well, I'll start first on the medical side. We were some of the first hospitals in California to treat COVID-19 patients. And at each of our medical centers, we have about 9,000 faculty physicians, 14,000 nurses, demonstrating day in and day out their deep commitment to making sure that their patients receive the highest quality healthcare, and also helping the public health aspect of COVID-19. We have more than 13 clinical trials underway, assessing the effectiveness of existing drugs in treating COVID-19. And we are also working to develop and test new ways to halt the spread of this novel virus. We have some 330 research projects underway throughout the UC system on different aspects of COVID-19. We're also doing some interesting things. For example, graduate students at Berkeley have been manufacturing and delivering hand sanitizer to Bay Area homeless shelters and the jails, hospices, and other facilities. Employees at UC Riverside's Theater Arts Department have converted from making costumes to making masks. Earlier this year, a team of 20 from UCSF went to New York City. They were in Queens to help with the terrible outbreak of COVID-19 they had there. And we also sent a team to the Navajo Nation, which was also has been experiencing a terrible outbreak. So on the healthcare side, we are more than fully engaged. On the education side, our campuses move very quickly to remote learning. We asked students who could to vacate the dorms, the dining facilities, and really in a way shut the campuses down to protect our students and workers, and also to make sure that we were not spreading the virus. We're now in the process of figuring out the next steps, like many of you. It will turn out that reopening will be more difficult than shutting down was. And there are lots of things to take into account. So we're in that planning process now. But our goal is that the University of California will be resilient, will emerge from this crisis intact and prepared for whatever the future holds. The University of California, it's a unique public institution. No other state has anything remotely like it. And it's one of the real assets that California has and can call upon in times like these. So with Jim, with that, Jim, why don't we start with the Q&A part?
Yeah, thanks. You know, you're certainly the president of what we call the crown jewel of California. The University of California is quite, quite amazing. So just in terms of a little housekeeping, there is for those of you, we have a few hundred participants joining us. There is a Q&A function. If you submit a question, I'll do my best to get to it. I have a bunch of questions of my own, and we have a limited amount of time, so I'll try to put the questions in categories so that we can cover as much ground as possible. I will warn that we have a wonderful dog, but she's got quite a wonderful bark and growl. So in case you hear that, it's not about you, Janet. It's just, that's the way it is. We also have a 4-week-old baby daughter, and sometimes she's a wonderful girl, but she can be a little fussy. So if you hear some crying in the background, that's probably my wife, but it could also be the baby. Or it could be me if my wife is watching this and catches up with me later. So let me ask you this, because I think this is really what's on the mind of all of us right now. And I'll ask you this within the context of your leadership of the UC system, but also as a former governor of Arizona and as the former head of Homeland Security. The country, you know, we led in this region the country in shelter in place and kind of getting people away from each other, which was, I think, leadership at its finest. I would say the folks, the governor and the health officials who led that, I'd put them in the heroes category. But as you stipulated, you know, getting us away from each other may be less tricky than getting us back together. And that's what we're going through now, you know, with a lot of different views being put forward on, you know, how best to do it. But no matter what, it's happening. You know, how do you see, in terms of the flattening of the curve that we experienced, what you think we might experience, what you're seeing others doing, you know, how do you feel we're doing this, and what advice might you have for President of the United States or the governor of California or any others willing to listen about how we best can, you know, protect ourselves from this incredibly challenging virus, and at the same time make sure that our economy is able to get moving again?
Yeah, so yeah, I agree with you that our public officials have done a really good job in California, and I would also say that the mayors have done a very good job, and the governor. the shutdown orders that were put in place did have the effect of flattening the curve. So when this started, Dr. Carrie Byington, who is the head of UC Health and is herself a specialist in pediatric infectious diseases, showed me some graphs which had a very steep curve for California and for the Bay Area in terms of what we might experience by way of people becoming ill and perhaps dying. And with the shutdown orders, those curves really flattened. And so while our hospitals immediately became COVID-19 hospitals and stopped all surgeries and procedures not COVID-19 related, the plain fact of the matter is that we never saw the surge in patients that we might have. And from a public health perspective, what you want to do when you have an epidemic like this is make sure that your healthcare capacity is never overwhelmed by the disease and by ill patients. And so by flattening the curve, we didn't see that in California. We did see it in some other places in the country. We saw it in New York. We saw it in some other cities across the country, Chicago by way of example, but we didn't see it in California. Now the challenge is, how do we reopen, as you say? And what we have to do is make our reopening decisions so that we don't resurge and get right back into that situation where our healthcare capacity is overwhelmed by the virus. And that means, I think, we should go slowly, that any business or institution that reopens has to have a plan for testing, has to have a plan for contact tracing, has to have the ability to socially isolate or quarantine any worker who is found to have the disease, and so it's going to have to be slow and measured as we go forward. I think the mayors and the governor are studying what we do in California, who is allowed to reopen, what standards they need to be able to satisfy in order to reopen. But in this instance, we have to be guided by good principles of public health.
Yeah, absolutely. And, it's just going to be, I think, very, very challenging, but it's just so important that we get it right. The risks are so great on all sides of this. And we're trying to do our best as an organization to advise best we can to find that balance between the public health, the safety, and the ability to make sure that we don't enter into a period of recession that'll be hard to come out of because it gets so deep. Let me, among the folks watching today, there's a lot of employers, there's CEOs, there's a lot of folks who are wrestling with how to keep their organizations running during this time. Federal government through the CARES Act provides some support, which is applicable to some and not to others. It's sort of limited in scope and duration, even though it's a very, very substantial and welcomed contribution. But a lot of folks have been forced to lay off people. In California, I believe the number is we've got about 3 million people who've hit the unemployment roll. That is unbelievable, and it'll continue to happen until things really turn around. At the UC system, I think you made the decision that you're not going to lay off people in the near term. You're going to keep things going, which I think is encouraging, because you need to keep your people. The biggest worry is you lose your people, you lose the talent, you lose your momentum. But I think those of us who are fans and people on this program of the UC system and value it are concerned about the future from a fiscal perspective. The state is about to go into arrears in ways we've seen before. And typically when that happens, the UC system doesn't fare very well, because you don't have some of the constitutional protections for your budget that other systems, both education systems and other parts of government, have. So what are you thinking in terms of making sure that as a result of this, we don't go through a wearing down of the fabric of the university that, it's so important to our state?
Yeah, Jim, thank you for that. First, yeah, we did make the decision not to lay off any career employee for COVID-19 related reasons through the end of the fiscal year, which is June 30th. The UC is actually the state's third largest employer, and we wanted to make sure that we were not contributing to the economic disruption that the state was experiencing, and that our employees had enough to worry about, but they wouldn't have to worry about their jobs through the end of the fiscal year. We're obviously now measuring the impact on our campuses and our hospitals due to COVID-19. As I mentioned, our hospitals had to cancel or postpone all non-COVID-19 related procedures. And those are the types of surgeries that produce revenue for the hospitals. So just through the end of March, we estimated that through reduced revenue and additional costs that our hospitals incurred, they lost close to $300 million. We also estimate that our campuses lost close to $300 million. The bulk of that was giving refunds to students for housing and dining as they returned home. So we were down 600. We're now measuring the full month of April. It's going to be ugly, and we have two major unanswered questions. One unanswered question is, what is our state appropriation going to be during the next fiscal year? And the second unanswered question is, what will our enrollment look like for the next fiscal year? On May 1st, students file their intent to register, and that will be a preliminary indication for enrollment, but only preliminary. And as students go through the summer, some of them may say, you know what, I'm just going to take a gap year, or I'm going to spend a year in community college. And so the summer, we call it the summer melt, could be significant. And we won't really know until school starts what our enrollment will look like. And so what we've been doing is planning towards different scenarios in terms of our budget. We've also been keeping both the governor and our congressional delegation informed about what the impacts have been and what they are likely to be. We did receive some federal money under the CARES Act. There was $260 million went to the campuses. Half of that was for student financial aid. So that was $130 million otherwise for the campuses. So we're still waiting to receive that tranche, but it's something that should arrive soon. And then through CARE Act 3 and CARES Act 3.5, there was a total of $225 billion made available for hospitals, and that's for all hospitals across the country. And we know that our hospital losses will be significant, and as soon as there's guidance for how we can draw down that money, we'll be seeking an application for our fair share. But neither of those sources of aid for the campuses or for the hospitals are going to fill our gap. And so we're going to have to take some significant measures to cut our own costs. And I'm working through that with our chancellors and our regents right now.
Thank you. A lot of work there, and let us know how we can help and send the good word. I'm taking a look. We're getting a lot of questions, so I'll try to lump them together. I think the one we're getting the most is about reopening. When will the university reopen? Will it be online? Will it be a hybrid? Will people be coming together? Should we require that a vaccine exists before we get people back together? What about dorms? What's going to happen in the dorms? So that's the biggest question that we're getting. Another one is on the admissions policy. How has the admission policy changed, given that the high schools are closed and the tests aren't SATs and so forth? So maybe you could kind of take those couple of questions.
Yeah, thanks, Jim. I'll take them in reverse order. In terms of admission requirements, and I give credit on this to the academic senate at the university, but they quickly resolved that students who have now a semester of pass, no pass grades, even in the so-called A through G courses. So under our admissions policy, you have to take a certain sequence of courses in high school. It's called the A through G, and you have to have a 3.0 GPA in those courses. So we relaxed that policy so that pass, no pass counts, and you could still be admitted to the university. We also suspended the use of the SAT for this year and next year, 2021, because the testing dates have been canceled, and it's kind of chaos out there with respect to testing. So those students who are applying to enter next fall do not have to take the SAT. It's optional. So that's that. With respect to reopening, college campuses are like, the most complicated thing, because you have lecture halls and classrooms and labs, dining facilities, all where, the presumption is that people will be close together. And then you have communal living in the dormitories. So you have that. So we're working with all the campuses. There will be kind of system-wide standards. They each should satisfy before reopening. And those are geared toward how to safely reopen. I think it's fair to say that none of our campuses will be fully reopened, like we turned a light switch and all of a sudden COVID-19 was gone and went away. I think what we are exploring, or some of our campuses are exploring, is a mix where there will be some material that is delivered in a classroom or lab setting, so-called wet labs, and other classes continue to be online. With respect to housing, we're not going to be able to reopen housing without testing, contact tracing, a place to quarantine if somebody becomes positive with COVID-19. And even then, we'll only be able to partially occupy the dorms. And so we're working through that now. I don't want to leave the impression that there will be actual physical reopening on the campuses. What I'm saying is that should there be physical reopening of the campuses, it won't be 100%. It will probably be greatly reduced.
Yeah, certainly, everything is going to be different in the future, and that'll be the case at UC. But you know, that's a big change, and I guess we thought we had a housing problem before, and now it's going to be at a whole different level. I wanted to mention there's a comment here, a congratulatory comment from the Consul General of Mexico, Remedios Gomez Arnau, and he wanted to congratulate you, President Napolitano, for supporting the initiative and call for projects to tackle health and other areas and challenges related to COVID-19 between the UC system and Mexico's National Autonomous University. So please accept that congratulations.
That's
but
nice.
It leads to an important question about your international relations. So, you know, one of the really valuable facets of the learning program at UC, you know, it's sort of in two phases. You know, one of them is enabling students to travel overseas and learn at other universities and engage in those partnerships. And then secondarily, you know, UC is the university of choice for many foreign students from countries all over the world. So will the admission policies related to foreign students be the same or different? And will there be, you know, what do you think is the future of international programs, given that international travel, at least currently, has really been set back profoundly?
Right. So we had to bring all of our study abroad students back to the United States. And we are now in the process of evaluating whether and how and where we can have study abroad in the fall or next spring. I agree with you, Jim. I think study abroad is incredibly valuable. I spent a good part of my junior year in London at the London School of Economics, and it was one of the best experiences of my life. And, you know, we want our students to have that opportunity. But this pandemic was global, and the impacts are global. And so we have to be very careful there. With respect to international students, again, we welcome them. They add greatly to the diversity on our campuses, the diversity of viewpoint, of lifetime experience, and so forth. And but I predict, don't know for sure, but predict that the number of international students that we have will be reduced. And then that's partially attributable to the administration, which has made securing visas to study more and more difficult. It's kind of using the visa program as a way to build a virtual wall around the United States. Unfortunate, bad policy, but that's what we have.
Yeah, let me refer to a comment from your colleague, the president of San Jose State University, Mary Papazian, who mentions that the CSU system, minus the hospital issue, is going through a lot of the same challenges that you are. She wanted to ask a question about undocumented students and the imminent decision from the Supreme Court and ineligibility of undocumented students for CARES funding support. Have you been looking at this? And I assume that you have. And what is the university and your own take on this one?
So with respect to financial aid for undocumented students, Unfortunately, the Secretary of Education, Secretary DeVos, ruled that they were ineligible for the student aid provided in the CARES Act bill. That was her interpretation. The bill was actually silent on that topic. Nonetheless, we have and are able to fortunately manage our student aid dollars so that there are other dollars that we can provide for our undocumented students. So, and we are doing that. With respect to the Supreme Court, as you know, the University of California was the first university in the country to sue the Trump administration for improperly rescinding the DACA program. DACA stands for Deferred Action for Childhood Arrivals. It's a program that actually I authored as the Secretary of DHS that provides that for young people brought here at a tender age, typically they're younger than 6, who've grown up in this country, graduated from high school in this country, attending university in this country, joining our country's military. Some 27,000 of them are actually now nurses and respiratory therapists, and some are even physicians, all working on COVID-19. 27,000. But if they are registered under DACA, they are free from the risk of deportation, and they can get work authorization. So we sued the administration for rescinding that program. There were several other cases filed around the country. All of the lower courts unanimously have held that the administration improperly rescinded the program. The administration took the case to the Supreme Court. Oral argument was held in November. We expect the Supreme Court to rule any day now. Typically, their opinions come down on Mondays. So we all watch the Supreme Court website early Monday morning because they post them at 10 o'clock East Coast time, and to see whether the Supreme Court will agree with all of the lower courts of the country.
Thank you. We wish you well on that very challenging issue. We touched a little bit on the subjects around research when we got started, but if I could ask you to expound on that a little bit. Obviously, the university's role in research is extremely important, to say the least, and always somewhat challenged, it seems. There's always, I think there's been, fairly consistent proposals to cut the research budget. I think so far Congress hasn't been acting on that. But could you talk a little bit about the role of research in the in the various campuses? We know that there's some amazing things going on, including related to the finding both a vaccine and treatment for COVID-19. How important is it? What would you suggest to folks in Congress and in the administration about the importance of scientific research at this juncture?
Yeah, if I were speaking to Congress right now, I would say, look, there are many needs for those federal dollars, but in terms of an investment that will help lead us out of this pandemic and perhaps prevent future ones, that research dollar is going to have a huge return on investment, a huge ROI. We have research on all kinds of things. We have research on how COVID-19 is affecting particular populations. For example, how it's affecting women who are pregnant and affecting maternal health. We have all kinds of research, as you mentioned, Jim, underway on possible therapeutics. Therapeutics being drugs that you can take that would help make you better if you get COVID-19. And then, of course, research as to a possible vaccine. A lot of this is done using genomics, and we have immense capacity in that area. We're really a world leader in so many of the topics that COVID-19 implicates. So, you know, there's just a lot going on, and it's really been one of the, if there's a good side to this pandemic, one of the good things is to see the immense research capability of this great public university, all motivated and targeted to one thing, and that's the pandemic. It's quite astounding.
Yeah, following on that, you know, another big impact has been the development of virtual learning. You know, this is something that's been, it's not new, but it's been developing, evolving for a period of time. This based on a question, by the way, from Steve. And, you know, despite the technology that we've seen to develop this, you know, we've continued to see a growth of enrollment at our four-year campuses. But the, good question, I think, is, you know, now that we're really digging deep and focusing, because we have to, on learning and teaching in a virtual environment, are we going to see folks continue to want to invest in an increasingly costly and in some ways challenging to access and to be housed in four-year campus kind of environment, or are we about to see some kind of a big shift?
So I think certainly the role of remote learning has been essential for us to be able to continue to develop or to deliver our educational product, as it were, and to let students continue to make progress towards their degrees. But the other aspect of this is it also has shined a light on the value of all of the other things that are part of the college experience. The ability to socialize with friends, the ability to network, the ability to enjoy all the social experiences of the campus, the ability to engage in extracurricular activities. You know, the university experience is classroom learning, and I think we'll have more online classroom learning, although I think it will be a supplement to, not a replacement for, in-class, in-person instruction. So we'll always have that, but it's all of the other things that happen in a college. And remember, the students at our universities are, you know, our undergrads are typically between the ages of 18 and 22. For most of them, it's their first experience living away from home. It's a tremendous period of maturation and growth in a student's life. And that all goes into the university experience. And so I don't think the pandemic is going to take that away. If anything, I think it's shown the value of that aspect of a university education.
Thank you. Yeah, I know when I was in college, I always managed to get in a lot of trouble, and in this kind of environment, you know, it's harder to do it. I still do it, but it's just not as it doesn't happen as readily, and probably not as much fun. With having served in your position now for this many years, working with the Board of Regents as well as with the legislature and the governor, how do you find, in terms of the way the University of California is structured, do you think that this comes from a system that dates back now quite a ways? Are we doing it right? Would you have as you're thinking of as not thinking but approaching the time that you leave, do you have recommendations for how we might structure either the UC system or higher education generally differently?
So I think that, the UC system has some unique strengths amongst the higher ed world. One of them is truly effective shared governance with the faculty. Most universities kind of give lip service to that. We really do it, and do it well. Another one is you have 10 campuses, each of them with their own chancellor. The chancellors report to the president to the board. That structure generally works well. It's a very federalist type structure. And so there's constant tug, should this be done system-wide or should this be done campus by campus? And we're working through some of those kinds of questions right now. I do believe that over the years, there's been an accretion of statutes, regental policies, presidential policies, standing orders, et cetera, that make some of the operations of the university less efficient, perhaps, than they ought to be, and it would be better if they were streamlined. But I've never met a standing order or policy that somebody didn't come to the vigorous defense of. So cutting through that and doing such streamlining, it's difficult. I think it's something we did some of during my presidency, but I'm also leaving quite a pile for my successor.
How do you see, following on that, how do you see the relationship with the faculty of the various campuses? They have tremendous amount of influence. And I should say, 1 quarter a year, I teach a course at UC Davis, as you know, so sometimes I work for you. But I don't think it's enough to bias my question, because I'm not a tenured member of faculty. But it's really, really important that we have the best, the brightest, the most learned folks teaching in this incredible university system. And I know, we've lost some people over time. We know a lot of cases like that where folks have gone because the opportunities, the benefits, the pay, can be better in other places. And, everybody is always looking at our universities to see if they can, maybe I'll nicely say, poach some of our finest people. So how do you see in that competitive framework, are we able, do we have the kind of relationship with faculty that makes them want to stay? And do we have the kind of system that encourages, people to stay here and come here?
Yeah, we really do. And yes, some people get poached by other institutions. I would have to admit that we probably do some poaching ourselves. There's some back and forth. But the faculty is really the fundamental bones of the university. And having a high quality faculty to educate the next generation, that's really what the university is about. So with respect to our current faculty, I think we're going to have to involve them. I think we're going to be in a period of shared sacrifice. We're going to have to make some tough decisions. We'll hopefully make those together. But as I mentioned earlier this morning, the financial impacts on the university have been serious and are not likely to improve over the next year. And so we're going to have to manage our costs so that we can ensure that the institution, the university, emerges from this epidemic intact and ready for the future.
Thank you. I got a couple of questions here referring or regarding our UC sports programs. So I think for some, those are, extremely important. I think, going on any campus, it's just amazing to see the opportunities there are for our students to engage in, all levels of athletics and clubs and intramural sports, as well as our competitive NCAA teams. And this has been a big setback, but it won't be forever. But from a longer term view, how do you see sports fitting into the university and campus life?
Yeah, so I think athletics is one of those things that people really miss with the closing down of the campuses. How we can safely reinstitute any form of athletics, I think, is an unanswered question. And so we've got teams working on that. And of course, the NCAA will be issuing guidance and for things that they have jurisdiction over. And so, for example, will there be a football season at Berkeley this fall? Personally, I don't know the answer to that question. You may, but those are the kinds of things that we need to have answers for because people really are interested.
Yeah.
Not to mention the athletes who train and participate in sports like football.
Yeah, and it seems like there's more of a movement towards figuring out ways to compensate collegiate athletes, but I don't think we have time to go there. That's probably not the purpose of this. Let me move back to your experience as a secretary for the Department of Homeland Security, in which, among other things, you dealt with the response to the H1N1 virus. So, if we turn on any news or open any newspaper these days, this is pretty much all we're hearing about. And, we've lost over 60,000 Americans in a very short period of time. We're now getting people back together again. How do you think the United States is handling this? Do you have any thoughts on maybe something we could be doing that's different, or reflecting on what you did that kind of headed it off? Obviously, we did not have the same impact from H1N1 that we're having here, but it's a different virus at a different time, different circumstance.
Right, Jim. So H1N1 was actually a flu, which was important because the first reported case of H1N1 in the United States was in April of 2009. So very early in President Obama's first term. I was a new secretary of DHS as well. But it emerged in April. By October, we had a national vaccine campaign underway, meaning that we'd identified a vaccine, tested it to make sure it was safe and effective, and had been able to have it manufactured in sufficient quantity that it could be distributed across the country. This is a different beast. It's a virus. We don't have a pre-existing form of vaccine. With flus, we have kind of pre-existing forms of flu vaccines in the inventory, and then every year there's this big group meeting and they decide what the upcoming flu vaccine, what kind of flu that year's vaccine needs to be manufactured for. They manufacture lots of it. People get vaccinated and so forth. Don't have that with viruses, and we don't have it with this virus. And so much of the research underway right now, and there's a real urgency to it, is to develop a vaccine. You have to be careful here. You can't take shortcuts. You might be able to compress some time periods, but you can't take shortcuts to the process. You have to test. You have to test in animals. You have to test in humans. You have to find out whether not only is it safe, but is it effective? You have to figure out things like your dosage levels, because dosages for children are generally lower than dosages for adults. So, and then you have to go into mass manufacture, and this is a global pandemic. And so 3.5 billion people in the world, you need to have ability to have 3.5 billion doses. If it's a shot, and it's a shot that you need not once but twice, you need 7 billion. Population of the United States is 300 plus million, same thing. So, you know what, you know, here's, you know, if I were in Washington, here's what I would advise the president to do. I would advise him to put a real emphasis on the whole vaccine issue, not only development, but subsequent supply chain and distribution planning. I would advise him to be preparing for a second wave of COVID-19, because we're going through the first wave now, but come fall, there very likely could be a second wave. And if you know anything about the history of the 1918 influenza epidemic, which was horrific in the United States, you'll know that it first emerged in the spring, then went a little bit dormant in the summer, and then reemerged with vehemence in the fall. And that's really where the fatality levels got out of control. And with respect to planning for that second wave, the federal government needs to ensure the supply chain for personal protective equipment and masks, ventilators, and so forth, that we have an established supply chain. Every state will have different needs, but we shouldn't have a world where states are competing against other states to get access to that critical equipment. They should be able to go to the federal government and say, we need, 30 million masks, and we need, 30 million sets of PPE, whatever, and then purchase them through the federal government. And so establishing that supply chain, preparing for the second wave, and putting real energy emphasis on vaccine and planning for how people ultimately get vaccinated would be where I would focus my efforts.
Yeah, thank you. I know in business, we, there's a lot of great ideas and plans, but most of the success comes from the execution of the program. And, what you've laid out is, it's a real challenge. And, all of our hope is that we'll be able to do this. You also raised the issues around, who's really in charge? Is this a federal response? Is it the states? Is it local governments, counties? Right now it seems like it's a little bit of everything. And, whether that's good or not, since we're running out of time, we'll probably leave to another conversation. I know you have another meeting, so I want to get us out on time. As a professor in this at UC Davis in the Graduate School of Management, I want to compliment you on your terrific leadership at UC and throughout your career. You've really set an amazing example for all of us, obviously for women, but for everyone who really cares about, a better society, a government that functions well, systems that work for the people who they're meant to work for, and a spirit of equity and fairness to all. And, I guess my very final question, you've got a minute to answer it if you want to be on time to your next thing, is what's the future for Janet Napolitano look like?
Well, I announced a long time ago that I would leave the presidency on August 1 of this year. There's a search underway for my successor. And when I leave the presidency, I will take a sabbatical year. And then I'm actually a tenured professor at Berkeley in the Goldman School of Public Policy. And I'm looking forward to joining the faculty myself and doing some teaching and thinking and research and writing. And I think that'll be a new, different chapter for me.
Good. Well, if you happen to need a visitor to talk about regional issues and the importance of working together at a collaborative level in government, between government and business and other institutions, I'm happy to come by sometime, and we'll look forward to continuing our relationship and the conversations we've had over time, which have been just really great. So from all the folks, thank you for participating. I tried to get to as many of the questions as I could in group, and there were some very, very good questions and comments. And President Napolitano, we wish you all the very best in your remaining months as president of the UC. You're grappling with some really tough things. We're glad you're there to handle this. So thanks everybody for joining.
Thank you, Jim.
And we'll catch you on our next Bay Area Council COVID-19 Impact webinar. Thanks everybody. Have a wonderful day.